Welcome, ladies and gentlemen, to this Geneva Urban Debate on Drugs. My name is Antu Duong. I am the co-director of this Global Cities Hub, and we're very pleased to co-organize this event with the Global Commission on Drug Policy, as well as UN Habitat and many other partners. The event is co-sponsored by the Permanent Missions of Switzerland. I've seen you in the room, of Colombia. I'm not sure I've seen. Yeah, you're here. Great, fantastic. Colombia is here. We have South Africa as well, who has co-sponsored this event, as well as OHCHR, who is represented here, Harm Reduction International, as well as the International Support Don't Punish campaign, and many other partners interested in this issue. I will be moderating this event today. The event, for you to know, is being recorded so that it can be replayed afterwards by others who would have missed our discussion. And it is going to be held in English only. Unfortunately, but that's the way it is. I know we have a lot of francophones around here.
I did prepare my introduction in French.
In French. So you'll have to bear with us. For those who don't know the Global Cities Hub, we are an organization that has been created 4 years ago. And we have two main objectives. The first one being to better connect local and regional governments to different processes taking place here in Geneva, to different issues. And we want to make sure that we talk about cities when we talk about human rights, humanitarian affairs, digitalization, health, basically. One of the major events that we co-organize is the UN Forum of Mayors that will take place in October here in Geneva with other partners. And the second thing that we do is that as the world urbanizes rather rapidly, we want to promote the urban on the agenda of the international community so that we better take into account urbanization in the policy work, programs and activities of various international stakeholders here in Geneva. So every year, as you know, on the 26th of June, we commemorate the International Day Against Drug Abuse and Illicit Trafficking. And today is also the Global Day of Action of the Support Don't Punish campaign. It's an initiative in support of harm reduction and drug policies that prioritize health and human rights over repression and criminalization. And against this background, we wanted to take this opportunity to organize a Geneva urban debate and apply an urban lens to drug policy. When we think about the different topics that are being dealt with here in Geneva, drugs probably don't come up on the top of our minds. However, there are a number of organizations dealing with that issue. And dealing with that issue, of course, from the point of view of public health and human rights. And you have, of course, the Global Commission on Drug Policy, but also the World Health Organization, UNAIDS, and of course, other partners such as the Human Rights Council, which also adopts a resolution on that issue. So this event today is really to shine light on the important issue of drug policies and what's going on in cities more particularly. And that's the reason why actually the Global Cities Hub is involved. So very pleased to collaborate with the Global Commission as well as UN Habitat today to discuss how drug policy reform can be advanced at city level, at the local level, where it matters for us, residents and urban dwellers. So without further ado, Michel Sidibé, let me give you the floor. I'm not sure I need to introduce you.
No, you don't need.
You're well known, of course, here in Geneva for having been the executive director of UNAIDS during a whole decade, from 2009 to 2019. And then, of course, you've been the Minister of Health in Mali. Among other things, you are a commissioner of the Global Commission on Drug Policy, which has been created back in 2011 by a group of eminent personalities wishing to inspire better drug policy globally. So please, you have the floor to introduce the Global Commission and tell us why you've decided to focus on cities
Oh, thank you very much for this excellent introduction. I would like just to say, when you reach our age, certainly my sister will tell you, you have a lot of former in your title. So I am happy at least to be a commissioner for the Global Commission on Drug Policy. And thank you for organizing this excellent gathering today. And I want to thank particularly the Global City Hub for hosting us in this magnificent setting. I don't know if you know, but we have a spirit of someone, a great man with us here. We have a spirit of Kofi Annan. Kofi Annan, as I think his office must be up there.
Absolutely.
So, and he is certainly listening to us because Kofi was not only a great leader, but he was very, very convinced that what we are trying to do today, we should have started long time back. He was convinced that war against drugs was killing more people than drugs themselves. And he was pushing us, creating certainly the West African Commission, making sure that this agenda could be on the table. And Global Commission also use him, even if he's not physically with us anymore, but his spirit is with us. I want to say just thanks. I don't know if many people in the room were knowing that his office was here, but it was very important for me. But I want also to extend our gratitude, like you did, to our co-sponsors. And UN Habitat, my friend is here. I think the UN Office of High Commissioners for Human Rights, and that has been mentioned. And the permanent, of course, missions of Colombia, Switzerland, and he didn't mention Romania, yes. But I think they are also with us for this meeting. They are very committed and they want really to see this agenda being advanced. But more than that one, what is very important, anytime we're talking about this type of gathering, we should not just think about bureaucrats. I think special thanks as well to the speakers who will be coming from local levels, from South Africa, Suwannee City, and from Glasgow. Those are people who are involved in the country level action, Melbourne in Australia, and also civil society. I think you cannot do it without those organizations. And I think about the international network of people who use the drug and harm reduction, because it's key issue. You don't want to be addressed urgently. Harm reduction, international is also with us in this meeting. So the subject of this meeting is particularly timely from my perspective. Is timely because, as you will hear from our expert, and that is very clear, panelists, I can say also, local level action in drug policy reform provides rapid, tailored, and community-focused solution to address the urgent and varied challenges of drug use and I think addiction. And that is very important. It's not just timely, I want to say. Furthermore, we are delighted, really delighted that today's session is happening with the World Drug Day, June 16, coincides with that day, this very important day. And the support, I don't have a paper, I should have shown you, and the support to Don't Punish campaigns, a day of action. This alignment underscores from from what we are thinking underscores today's themes, which highlight the crucial role of cities in driving policy reform. And also, I want to just say, over the past 12 years, the Support Don't Finish campaign has organized a series of activities. I can even say 2,100 activities, which is, I didn't count, but someone gave me this data, and I'm sure it has been checked before. But across more than 300 cities in 125 countries, which is amazing. We didn't start 100 years ago, but it's showing the commitment coming already from local level. This campaign particularly stronger in global south, focuses on building what I can say sustainable alternatives to the wars on drugs, like I was mentioning, Kofi Annan, past Kofi Annan, and emphasizes harm reduction, which decriminalization, let us not forget, and community leadership. And that is a key words, but I wanted to really insist on them, harm reduction, decriminalization, and community leadership. Since the inception in 2011, the Global Commission on Drugs Policy, you will hear certainly my sister, President Dreyfus, talking about that. I think on the drug policy has leveraged the influence and the reputation of its members, because we have a high-level former politician involved in this commission, and they have a capacity to really drive the agenda and put the agenda on a high-level politician, table. So regarding today's themes, I think local level action, the Global Commission advocates for supporting local drugs policy reforms that prioritize, again, health, you were mentioning human rights and safety. Keywords which are very important. Local governments being closest, as you know, to the community are crucial in designing and delivering public policies, including drug policies. Despite bearing significant financial, and which is very important, social and human cost due to the repressive drug policies, cities have the potential to drive innovative initiative that can inspire national change. And is key because I experienced that when I launched really the city programs on HIV. Yeah. And the capacity to mobilize, to bring the debate around a policymaker table, and to really demonstrate that action can happen. And even it has been opportunity to start talking about how to address the issues of people who inject drugs in the city. So I want to say, recognizing this, the Global Commission has held a consultation with local governments in cities such as London, Bonn, I think Geneva, Glasgow, and the last one was Amsterdam. We were to go there. Last year, we began also developing a cities strategy. I think it's so important for drug policy reform. And we are working closely with all the partners I was mentioning, including UN Habitat. So one key outcome of these consultations is the development of common principles, I think, and a shared approach to guide the local authorities in their drug policy reform efforts. And that is very important. And I would like to just say, lastly, I would like to share the Global Commission Drug Policy Cities animation.
Yes.
That is important. I know we are all waiting for that, not what I was saying, which focuses on the pivotal role of local authority, how they can really be one of the key to really push this drug policy reform. So it is available on the Global Commission's website, www.globalcommissionondrugs.org. Thank you, and I look forward to a productive discussion today. Thank you very much. We can project that?
Yes.
Thank you.
Let's hope technology works.
Throughout history, cities have attracted people in search of better incomes, access to education, and health services. Cities became melting pots of intertwining cultures, creating new job and housing opportunities for growing populations. However, cities are also divided between rich and poor, old residents and newcomers, creating various mechanisms of exclusion, discrimination, and marginalization. Fear spread that these marginalized populations were a breeding ground for disease and immoral behavior. Authorities reacted with repressive actions, fostering stigma and discrimination. Drug use was seen as a threat to the health of the population and debilitating to productivity. States around the world adopted the 1961 Single Convention on Narcotic Drugs and then the 1971 Convention on Psychotropic Substances, resulting in the rise of drug prohibition around the world. Drug prohibition handed the production, trafficking, and the supply of drugs over to organized crime groups that exploited the vulnerability and poverty of people who use drugs. In 1988, the international community took repression even further by criminalizing the possession and consumption of drugs. More countries tightened their laws, which led to mass incarceration, once again targeting minorities and certain underprivileged communities. Illegal drug markets continued to flourish. Drugs became even more accessible. Vulnerable communities faced human rights violations and abuses. Families were torn apart, and underprivileged communities became targets of disproportionate law enforcement interventions. The spread of HIV and AIDS, linked with growing drug consumption, exacerbated the epidemic and the stigmatization of people who use drugs. Repressive policies caused new and widespread health and social challenges for cities. People who use drugs were faced with unemployment, homelessness, and a lack of access to medical care and social services. A more humane approach to drugs is necessary and is possible. Progressive cities are prioritizing the health and well-being of their citizens and investing in treatment, harm reduction, prevention, and social services. And it works. Local actors all need to work together, including police, doctors, social workers, people who use drugs, and others. A drug policy needs to be comprehensive. In cities where a humane approach to drugs has been implemented, it has been proven that HIV and Hep C prevalence rates have declined. Safe consumption facilities have prevented overdoses, and drug testing has saved lives. More people are spared prison. Families remain intact, and people who use drugs are able to make a living. Cities can use their margins of maneuver to develop pragmatic responses at the local level. A drug-free world is an illusion. We need to abandon the war on drugs, which in practice is a war on people. The world cannot afford another 60 years of prohibition and the harms it causes. The Global Commission on Drug Policy advocates for drug policy reform, based on human rights and scientific evidence. It has developed key recommendations for sustainable drug policy reform and evidence-based practices at cities level. The Global Commission supports cities taking action to put more humane drug policies in practice and is promoting a city strategy from drug policy reform.
Thank you. Thank you, Michelle Sidibe, and I think you, your speech and the video have really set the frame perfectly about the topic of our discussion today, talking about alternative ways of thinking and doing when talking about drug policy reform. It's now my pleasure to hand over the floor to Graham, our friend, a long-standing partner of the Global Cities Hub on the engagement of local and regional governments at the multilateral level. You are, of course, the main UN entity dealing with sustainable urban development, and UN Habitat comes across drugs when you work with urban health, when you work with urban security, safety on the ground. So tell us, and you were the one that basically came to us and tell us, you know, we need to talk about drugs. So tell us about UN Habitat's work on the issue and how you address it on the ground. Floor is yours.
Thanks very much, then, and excellencies, distinguished guests. It's an absolute pleasure to be here in partnership again with the Global Cities Hub. You know, I think it's also worth remembering, I'll be accused of being like a stuck record, but there's still, we have to remember the way of urbanization, the march of urbanization that's going ahead in the world, and how it's really not considered. There's always something else that's coming and taking attention from what's happening with urbanization. By 2050, 68% are going to live in an urban agglomeration of some kind. So it's not just half of the world doing this, it's the vast majority. If you dig deeper, and we heard about the issue of inequities in the film, if you go to sub-Saharan Africa, for example, of those urban populations, 60% live in informal settlements. They live below the radar, they lack services, whether they're basic services, social services, medical services. The other important statistic is that of all of the space that will exist, the urban space that will exist in 2050, 60% has yet to be built. So on that respect, anything we do, whatever policies we design, have to address the issues of now, what we're dealing with now, whether that's epidemics of drug use, what have you, but they also have to influence how urbanization goes ahead and the design of future urban space. And that issue is very critical to what we're talking about this afternoon on drugs. Of course, a lot of this is driven by inequity. We know that those in informal settlements have much lower statuses of health, of education. But this goes beyond just the physical health, also into the well-being. And we've heard about the issues of mental health now, which of course is a result of drug use. But for me, one of the important issues of why we need to look more closely at drugs policy and how we should work it is it's consuming vast amounts of money in the policing of the control of drugs. If you look at most municipalities around the world, the money that they're spending just to hold the system as it is phenomenal. It's such a large budget. And of course, it's meant that the money is going into the hands of the wrong people, where it should be for the municipalities to provide services to those people. It's going in to trying to protect those people and to go against this. I just looked at some statistics of what gun crime and the cost of gun crime. And in the Caribbean, for example, the cost of treating a gunshot victim, non-fatal injury in a hospital is $7,000. If you go to the US, it's $170,000 to treat one victim of one gunshot wound. That's to give you an idea of what the cost is from a public health perspective of this drug issue. So we need a new policy about it. That's why Habitat's very pleased to work with the Global Commission to help to understand against this fabric, this mosaic of cities, how we can bring our expertise to support the ideas of new policy reform. We need, of course, I've mentioned the issue of expenditure. We also need to understand the issue of human rights, again, in urban settings. And also, of course, that this is a public health issue. And it's great to put in place these new policies, but you also have to ensure, if you're going to bring in control, that you put in the necessary social and support systems to do that. So you can't just cosmetically go in and change policy. You have to have a robust governance system at city level to do that. And I mean, you know, you're competing with other diseases, with other non-communicable diseases, lifestyle diseases, with communicable diseases. So it's not an easy issue, but it's, you know, we have to start somewhere. In terms of our work at UN Habitat, I mean, we've been following an ECOSOC resolution in 1995. That's when UN Habitat started to get more into urban security and safety. And in those days, the idea was that we were looking about how we could reinforce local government structures to provide better safety. And a lot of this was about technical support and technical assistance, but also brokering partnerships between community and local authorities. As most of you know, the key to solving many of these problems is to work very closely with the stakeholders, with the communities. If city managers, if city leaders see the communities as an extension of their capacity, then you see things start to work. So this was the root of lots of Habitat's work. And of course, the idea of that and the idea that partnership and networks are very important led to a resolution at our Urban Forum in 2012 to establish a global network of safer cities, which of course is in existence today and focuses again on this idea of security and safety, working with civil society. We think that it's very important for this new drug policy to be considered properly by urban safety and public health strategies at city level. And you know, we would go a long way to support the Global Commission on Drug Policy and other partners to do that, to see how we can weave this issue so it's front and center of city level policy. And then we've gone a bit further than that. We're in discussions with the Global Commission for a deeper relationship. But we would like to see some form of indicators at the local level. There's the indicator that exists at national level to track drug use, but we would like something that's at the local level which will reflect the local context, bringing in the human rights and the public health perspectives. So if we can look at that more closely, we will, of course, take every opportunity for the advocacy of this approach, both our World Urban Forum, which comes up at the end of this year, a meeting of city managers. But I think most importantly, in addition to managing what's now, we need to also look at the implications of future urban space. So there's a lot, Habitat works a lot with urban planners and those looking at what future urban space can look like. And, you know, from access to services, but also providing safe environments, physical environments with access to open space managed in a way that's safe, and security and safety. These are also issues which I think we have to look to the future, because in many urban centres, in many around the world, they're looking to not just expand, but also create new cities and new urban space. So we also need to take that into consideration. So we're absolutely honoured to work with the Global Commission on Drugs, and we look with reverence to the formers, as you call them, Michelle, but you know, these are our parents who guide us and keep us on track and give us the knowledge of their wisdom to move forward. So that for us is a marvellous opportunity to work with the Global Commission. So delighted to be here. Thank you.
Thank you. Thank you, Graham, and great to know that, you know, you really look at this issue from your urban safety and security mandate. It makes a lot of sense. Before going out to the cities, I'd like to give the floor to Zaved, who is with us today. I know it's getting late in Melbourne, but I just want to finish maybe with the speakers there so that we can switch afterwards. Zaved, you of course are representing the Office of the High Commissioner for Human Rights today here with us. You are a senior drug and policy human rights advisor, and you have been following this issue for a number of years now. Human rights have been mentioned a lot of times at the very beginning of this issue. So please tell us, how does the office work in relation to drug policy? And how do you engage with cities on that matter? Is that it?
Thank you very much, Anne, for your kind introduction. And also, I take this opportunity to recognize the day, World Drug Day, as well as Support Don't Punish Movements Day for the global action. And across the world, exactly at this moment, lots of grassroots organizations are involved in the movement and talking or asking for more human rights approach and public health center approach drug policies around the world. On this occasion, Office of the High Commissioner for Human Rights very pleased to co-organize this event with all of you. I don't want to repeat the name, already you have heard all of your name. Also, I would like to recognize my colleague, Janika Pisto. She's here. She works on the global government and human rights. So we have also colleagues working on this issue. And also I noticed that number of countries are represented here. They are also leading the discussion at the Human Rights Council on drug policy, as well as human rights and local government. So I'm really pleased to see this combination of member states present in this room. I'm not going to make any speech as I discussed with Jennifer and others. I would just like to introduce our recent report, which is published recently. It is available outside. Human rights challenges in addressing and countering all aspects of world drug problem. In this report, we have identified key challenges with regard to drug policy. Just very briefly, I would like to mention a few issues as well, statistics. The globally over 296 million people use drugs now, an increase of 23% over the previous decade. So it is moving that direction. More people using drugs there. However, only 1 in 5 people suffering from drug-related disorder receive treatment for drug use in recent years. So it shows that where we stand with this problem. And just yesterday, a new report from the WHO came out, they published, highlighting that 1.6 million deaths per year is due to drug-related causes. And out of this 0.6 million, 0.4 million of drug attributable deaths were among men. And if we also try to dig out a little bit more, I'm sure it will be in the cities mostly on all these things. Most of the deaths which we know is coming in the cities. Unnecessary and disproportionate use of punitive approach during the drug situation had led to prison overcrowding. And 1/5 of the prison population of the world now related to incarcerated due to the drug-related offenses. So that statistic also shows that who are there. In the report, we identified 5 key concerns. One is the lack of equal access to treatment and harm reduction, over-incarceration, I just mentioned, and prison overcrowding, use of the death penalty, disproportionate impact of the punitive policies on marginalized group. Already previous Graham mentioned about that in the cities who are the marginalized group living in an informal setting or under the poverty and all these issues, and the war on drugs. And most cases we have seen this war on drugs in the cities, which has been recent time. If you look at the war on drugs, whether it is in Rio or any other urban settlement, this is mainly carried out in the cities mostly. In the report also, we showed some positive example that member states how they're moving away from these repressive measures and taking new approach, which is based on human rights, public health, evidence, and development. For example, Colombia is shifting human rights and development focused drug policy, moving towards that. Within that, just our office in Colombia, working with 3 municipalities to look at how this new policy could be implemented at the municipality level. Ghana adopted legislative change for public health friendly drug policy. I had that opportunity to visit Accra 2 years back, and we engaged with the local authority over there. and how they could take up the harm reduction program and all this. I will come back to that. And then Scotland, yes, we are going to hear from Scotland, Glasgow, established first official consumption rule. And this is led by the Glasgow City Administration, Mayor Office there. And also in Scotland, they drafted a charter of human rights for those affected by drug use. And this year they are going to launch that. Also several other countries, some, for example, Malaysia, Indonesia, also Mexico, our colleague here, Switzerland, Germany, they have made significant legal reforms towards more human drug policies. I would like to give one example from the Global South. Recently, I had the opportunity to go to Pakistan to engage with the authority to discuss about the drug policy related changes. One of the key outcomes was engagement with the Lahore in the city, one of the big city, Lahore, the administration of there, prosecutor office, prison authority, and all. And all of them came on one conclusion: the decriminalization needed, because over-criminalization is creating a problem in their prison system, justice system, judiciary, and all these things. It was engagement with the local authority gave us that opportunity to discuss and advance. Let me very briefly go through few recommendations, which I think that important in the context of our discussion, mainly role of the local government or city administration. Obviously, we are talking about there is a need for shifting away from the punitive approach to address human rights challenges, including exploring alternative to decriminalization. Obviously, it has to be done at the central level or the legislative level, which is city that is needed. But city could help to develop, forward the discussion, why it is needed, decriminalization shifting the position. Then the issue of the treatment of drug dependence issue, treatment should be must voluntary and informed consent should be the prerequisite for any medical intervention. And many countries, the treatment or health issue devolved jurisdiction. Many countries, the local government is responsible to looking at the health perspective. So definitely they can play a role to ensuring this issue. Then the issue of the harm reduction measures. We are recommending to promote and implement the harm reduction measures. This Monday, UN Special Rapporteur on Right to Health submitted her report on the on drug use, harm reduction, and right to health. The report, she affirmed the harm reduction intervention particularly important for the population that are often stigmatized and discriminated against in the context of drug use. This issue, harm reduction, is really important for the city authorities to consider. And I think that in the report, Global Commission report, it is very highlighted that how city government administration can help to move forward the harm reduction measures. Already I mentioned the Glasgow initiative in Glasgow, setting the consumption room and all this. It is a city initiative, city with the role there. Authority at the state level, including city authorities, must ensure equality and non-discrimination in drug policy design and implementation. It's really critical. Sometimes also there is need for the gender responsive lens into this. Last 2 points I would like to mention. One is the law enforcement. Already Graham mentioned about the policing and all these things. In many contexts, local government has the full jurisdiction on the law enforcement. So how to change their behavior and bring them into the human rights compliance or public health aspect or other policy aspect, how they could better implement. There is a need for better law enforcement officials, better trained, particularly with regard to when they're just addressing the drug-related issues. That if they do not have adequate knowledge on harm reduction and harm reduction education, it brings to the education issues, that will be also important to consider. Last point I would like to mention that our report recommend addressing underlying socio-economic factors is paramount to address the drug-related risks and also other aspects of that it includes poverty, it includes marginalization, it includes gender insensitive policies. So all these things I think would be important to consider. And lastly, I'd like to mention the meaningful engagement with the civil society organization, particularly in the cities and on local level, like grassroots organizations. I'm not talking about international civil society, but grassroots, bring the grassroots organization into the discussion, engage with them. That would benefit for us to move forward the right direction, which is human rights and public health oriented drug policy. At the end, I would like to request everyone to look at this report, and you will find, we talk about always human rights-based approach to drug policies, but what does mean by that? This report and recommendation will provide you response to that question. Thank you very much. And I think it is also very useful document would be for the local authorities.
Thank you for that. Thank you for reminding us about the statistics and about the silent crisis that is really unfolding in cities, as you said. Cities, are the source of the problem, but also where the solution can be found, actually. So it's very interesting, and thanks for providing cities with that kind of useful tool for them to address the drug crisis. Let's now turn to what's happening in cities and what kind of drug policies are being put in place there. We'll have the pleasure to learn from the city of Glasgow and also have a video message from Twane and Melbourne. If Mr. Dean Robertson is, no, he's not there. So we'll go directly to Mr. Alan Casey from the Glasgow City Council in the UK. You are online with us. Yes, you are there. Sorry, thanks.
Hi.
Thanks for being with us online today and for your patience. Mr. Casey, please tell us about the situation in Glasgow and also about, I understand, the plans to open a UK safe drug consumption room, which should offer a crucial service that can help reduce harm and prevent drug death in Glasgow. The floor is yours.
Thank you very much, and good afternoon from Glasgow. I'm really sorry that obviously I can't be with you in the room. There is an unfortunate circumstance where we've got a general election coming up next week, which makes that rather difficult, but hopefully it does provide us with some opportunity for progressive change in the UK, and certainly that's something that as Glasgow as a city, we will be continuing to advocate for progressive drug policy when a new incoming government maybe comes in next week. But yeah, thank you obviously to the Global Commission and the Cities Hub and indeed the City of Geneva for inviting Glasgow along to this meeting today to give our perspective in terms of what we are doing to drive local change. And as I say, it's really good that the Global Commission are giving a voice to local government, because it is us that are on the front line driving that and indeed implementing that progressive policy. And as I say, we are very supportive of a human rights-based policy platform, and that is exactly what we'll be doing. I suppose in terms of the context for Glasgow, for folk that don't know, we are a city in Scotland, and we are the biggest city in Scotland, actually, with a population of around about 635,000. And Glasgow is a city steeped in great history of heavy industrial industry and indeed innovation. But we've also had a difficult history across the years with alcohol and drugs, and significant poverty issues and areas of deprivation across our industrial landscape. And those difficulties have led to many drug deaths and harms associated with the problematic use of substances. And it's suffered with low life expectancy in our most deprived communities. And unfortunately, we've had the unwelcome label of being the epicentre of Europe's drug-related deaths. But analysis from 2022 of drug-related death statistics highlight that an individual is over 15 times more likely to succumb to drug-related death if they live in the most deprived areas. And it's suffered with low life expectancy in our most deprived communities. And unfortunately, we've had the unwelcome label of being the epicentre of Europe's drug-related deaths. But analysis from 2022 of drug-related death statistics highlight that an individual is over 15 times more likely to succumb to And in Glasgow, around 60% of our drug-related deaths occur within that highest level of poverty or deprivation, which is obviously really challenging for a city like Glasgow. And in 2022, we had 196 individuals who sadly lost their lives due to a drug-related death, which was slightly down from the 311, which was the year before. Now, as a city, we don't stand still with these problems. And as I say, we're really forward-thinking and progressive when it comes to policy making, indeed strategies. And last year, we introduced a new alcohol and drug partnership strategy, which is over the course of the next 3 years. And our vision is obviously for the people of Glasgow to live free from the harms of alcohol and drugs. And we want to improve the quality of life for somebody who is suffering harm through alcohol and drug use, which is really, really important and goes back to the points about having a human rights-based approach. And our strategy is across a kind of multi-agency group who look at developing local strategies to tackle problematic use of drugs in our area. And we have really good relationships with our NGOs, third sector partners, our healthcare service providers, and indeed our and public health colleagues. And the strategy itself has 5 key themes to work alongside that in terms of prevention and education, harms, our city centre work, children, young people and families, and recovery, which is our kind of benchmark strategy alignment. But in terms of the problems that we are facing in Glasgow, we do have a drug trend monitoring group, and that gathers intelligence in relation to the drug market from a collective group of people, including police. We obviously look at the injecting equipment provision, toxicology reports, and indeed speaking to people who are using drugs to learn from them how we can respond to the change in pattern in drug use. And we are seeing a significant increase in the injection of cocaine in Glasgow, some of whom are injecting multiple times a day, on top of other substances being taken at the same time, which is really problematic for us in the city. And the high frequency of cocaine injecting is increasing harms related to injecting sites and bloodborne viruses, as we all know. And I suppose cocaine is now present in nearly half of all drug-related deaths, either alone or in relation to other drugs at the same time. So that is the highest level ever recorded in Glasgow. I know I don't have a lot of time, so I won't go too much into the statistics, and we can send over some slides if folk want more information on that. But I think it is important to note about some of the interventions that we've made locally in the last couple of years, and I'll talk a wee bit about the drug consumption room that has been alluded to earlier. So we have opened the UK's first heroin-assisted treatment service in 2019. And that has obviously been a really positive step in terms of harm reduction. We have a non-fatal overdose response team who go and engage with individuals who have had overdoses and trying to kind of support them into treatment as quickly as possible. We've obviously got a wound care service. We've got availability of same-day treatment for folk and choice of treatment, which is really crucial and important. And we've got a full range of harm reduction interventions and trauma-informed social supports as well. Obviously, we have led the way in the UK of making the case as a city for opening a safe consumption facility or an open supervised overdose prevention centre. And gladly, over the last year, we have managed to win that fight and win that case to get the permission to open a safe consumption room in our city, which is a huge step forward in our progressive policy making. And that is hopefully going to be opening in the next couple of months. And I would really welcome any visits from any colleagues on the call today to come and see us and help us implement that over the next couple of years. And as I say, that's a massive step forward. But as a city, we're really proud to be working alongside the Global Commission on Drugs Policy to implement even further progressive policies. And just last year, at the tail end of last year, I took forward a policy to our full council meeting, which ultimately looked at the city supporting the basis of decriminalisation of all drug use and all drugs in the city, which is a controversial thing still in the UK when we're operating within the confines of the Out of the Misuse of Drugs Act, but we took a bold step to say that that regressive policy must go, and we believe that the full decriminalisation of drugs for folk using them is the way forward. And indeed, we're having conversations about whether or not we actually have to go even further than that policy. But we were very proud to join the Global Commission with the Scottish Government in launching that progressive policy platform just last year. And as I say, we are very, very honoured to be part of this discussion, and we're very, very honoured to be working with the Commission on the way forward to progressive drug policy in the UK, and we'll lead the way in doing that. Thanks very much for listening.
Thank you so much, Ellen Casey, for that. Very interesting to hear what you're doing on the ground and that you're paving the way for other cities in the UK, but also mainly worldwide, to follow you and to be a little bit more progressive with regard to drug policy. We're running a little bit late. Let us now turn directly to another city voice with a 3-minute video from the city of Tshwane in South Africa. Mr. Kwena Nkoko, who's the group head of health in Tshwane, will tell us about how his city is addressing drug and substance abuse through evidence-based policy. It's a 3-minute video.
Hi, my name is Kwena Nkoko, the group head of health in the city of Tshwane, South Africa. To address drugs and substance abuse, the city of Tshwane strongly believes that drug policy reforms practice must be evidence-based, driven, and advanced at a city level, purely because cities are the most impacted sphere of government because of their closeness to the communities. To ensure context-specific and relevance, the city of Tshwane used evidence from the community-oriented primary care, which we call COPC in short, approach to develop, adopt, and fund community-oriented substance abuse program, COSAP, which is our flagship program, as a policy vehicle to drive drugs and substance abuse. Through our 16 COSAP sites as well as our outreach program, we provide demand and harm reduction services, which include, amongst others, education and awareness, opioid substitution therapy, which we abbreviate as OST, needle and syringe programs, aftercare services, and many more. More than 5,000 people, of which 750 are already on OST, are reached on a monthly basis. To reduce the impact of drugs and substance abuse on homeless people as well as poor communities, we have introduced what we call street medicine program, which takes services to these beneficiaries in their localities. Through COSAP, we also improved integration of care as well as coordination of care. This has resulted in reduction in morbidity in drug users in as far as HIV, AIDS, and hepatitis is concerned. We have moved away from a punitive war on drugs, which used to dominate our strategy, to a more human rights and caring approach, including by our law enforcement officers. COSAP evidence continue to influence national policy on HIV as well as hepatitis, including our national drug master plan. All these achievements have been through a strong partnership between the municipality, University of Pretoria, NGOs, as well as other key stakeholders. As a city of Tshwane, we remain committed to championing policy reforms in favor of the vulnerable. Thank you.
We do see similarities between the approach of Tshwane in South Africa and Glasgow in the UK in terms of focusing on the most marginalized communities. It's been said several times, addressing drugs is a multi-stakeholder effort for the society. Tshwane just mentioned that they were working with the university, with civil society as well. So now I'm turning to civil society. Julie Chang, you are the Executive Director of the International Network of People Who Use Drugs, Input. It is a global network that seeks to represent people who use drugs at the international level, represent people at the international of people who use drugs. And your network promotes health and defends human rights. We've heard it throughout the event. The human rights of people who use drugs, actually. So why do you think that focusing on city makes sense? You know, what does that bring to your network? And what achievements can be put forward in cities? Judy, you have the floor.
Sure. So I think local level reform is very important. We know that it's more likely to occur in alignment with people's lives and realities. There's more space for innovation and action to be taken, because I think, you know, also the political and social consequences, you know, of decisions and policy making are more directly witnessed by mayors and local leaders. And of course, then when designing local policies, you know, it makes sense for these policies and programs to be designed and developed for people, you know, and it needs a leadership and mobilization of directly impacted communities. You know, you have to, in designing policies, you have to be able to understand what people's lives are like under current policies, or in some cases, the impact of a lack of protective policies and regulations. And also, you know, to be able to predict and understand the impact of any proposed changes on people's lives. And that can only come from the meaningful input and involvement of affected communities. But when it comes to drug policies now, you know, too often people who use drugs are not being listened to. We're not treated as a body of citizenry that have the right and capacity to be able to influence decision making. But, you know, there are some examples to point to at the local and state level. And, you know, thank you to the Global Commission for giving us the opportunity to highlight some of these. So one was from the City of Melbourne, then the state network is called Harm Reduction Victoria. And at the state level, there is a lived and living experience leadership strategy when it comes to drug use and mental health. So that, you know, really provides an overarching framework. Harm Reduction Victoria, they've partnered with local decision makers to begin reform of the opioid-dependent treatment programs. There are also, you know, research agendas to point to with community involvement. And I mean, not only involvement, but the leadership of community, and Harm Reduction Victoria working with Burnett and Liverwell. And these institutions, you know, have helped open the door, but really left the community to be able to drive the research agenda and put their priorities forward. Also, they've partnered with Burnett Institute and the Melbourne Council on a naloxone roundtable, and they've been discussing naloxone vending machines, and the state government have committed to fund them across the state. So I think, you know, that's a really positive example. Another example shared by the South African network of people who use drugs. They were consulted in the development of one of the first drop-in centres in Durban, so Belhaven. And also there's a lot of peer involvement in the operations of the services as well. And it is recognised as an important model, I would say nationally, but also regionally and internationally. And it shows that, you know, with peer involvement, they're able to reach people who use drugs in a very, you know, difficult context. But also, you know, of course, the results or examples, you know, are mixed. There can be, you know, even within the same city, there can be, you know, good practices, and then also, of course, areas for improvement. So one other network, GATT, in Portugal, you know, there's a long history of GATT, you know, working with city, regional, and national authorities, including the Ministry of Health, National Coordination of Addictive Behaviours, and also regional social welfare leaders, among others. And Porto, you know, over the last few years, the local government, you know, they are financing 1 year of operations of the drug consumption room, but still there needs to be, you know, this defence against potential recriminalisation of drug use. You know, there's still financing of the reinforcement of police authorities, and also, you know, a tough surveillance system. So it always needs, you know, that monitoring, you know, from community. And then we see, you know, even when positive changes are made, you know, community are saying that they can see how the changes are, you know, influenced by their campaigns, articles and speeches. But, you know, without that kind of formal mechanism of consultation, there ends up being issues as well. So just one quote from a representative of State Network. They said, what I find typical behavior, however, is that none, so local leaders, have approached us for cooperation at any level, and our ideas and experience of what works has been ignored. So a second quote was, whilst we commend the introduction of a drug consumption room with no peer involvement does not work at full capacity. So even though this is very, rapid reaching out to community to get examples, it was hard to, I think, collect best practices, but I think, just hearing from the community, the recommendations, I think are very clear. So one, that there should be formal mechanisms of consultation that should be, created for policies, research and practices. And, ideally there should be some type of official strategy, such as in the state of Victoria, Australia. There should be elements of capacity building to engage in processes, and these should be built in, because we know that consultation is not a one-off process, but a long-term process. Communities should always be enabled to lead, or with a plan to transition to community leadership, whether working groups, platforms, forums, etc. And lastly, just to point out, core funding for representative networks that are accountable to their communities, is critical. You can't expect to draw on the expertise of community that is truly representative, without that funding. Community mobilization takes a lot of many years sustained work.
Thank you so much, and it's great to hear, good practices about how to engage with those affected communities that we don't hear that often, actually. Contrary to many other groups, I would say, in vulnerable situations, with, women, children, indigenous people, we don't hear much about drug users, and I think it's important to recall that important aspect. Let me now turn to Ajeng. Sorry, I've got the name here, Ajeng Larasati, if I pronounce it correctly. You're the human rights lead at Harm Reduction International, an international organization that envisions a world in which drug policies uphold dignity, health, and human rights. Again, we're going back and back to human rights and health. So I have the same question to you. Why do you think it's interesting to focus on cities, and how you go along with that work with local and regional governments? Floor is yours.
Thank you, and thank you for the introduction, and thank you for having me here at this important event. You've mentioned about harm reduction and our mission. Harm reduction, you state that, and advocacy to promote harm reduction in drug policy reforms. And we show how rights-based, evidence-informed responses to drugs contribute to healthier, safer societies, and why investing in harm reduction actually makes sense. Just yesterday, our excellent sustainable financing team launched a report that is called The Cost of Complacency, and it explores the state of harm reduction funding in low and middle income countries. And the data from that report shows that we are still far from meeting the needs of people who use drugs. The UNAIDS forecast that an effective response will require $2.7 billion per year by 2025, yet the funding is just 6% of that amount. So harm reduction has a 94% of funding shortfall. And all the while, there is also a funding gap of 29% for the overall HIV response. And although the global aid strategy called for an intensified harm reduction response, the political commitments have not yet resulted in a greater investment in harm reduction. What is relevant from that report to our discussion today is that we saw some advocacy works that are taking place to secure funding at the city or provincial level in complementary to the work in the national level. So for example, we recently worked with colleagues in South Africa to document a good example of the city level domestic funding, which is the Swane example, which we have seen. What is interesting from this example is the government in the country, government funded service for people who use drugs are abstinence-based. And the only public funding for harm reduction comes from that city of Swan, where they funded the COSUP, the Community-Oriented Substance Use Program. As part of COSUP, and this speaks to what Judy mentioned earlier, people who use drugs are included in all the processes, from the design, implementation, research, and also community advisory groups are consulted to ensure the services provided match what is needed by the community. And this model shows how partnership working at community level can create enabling environment actually, and that is able to withstand political changes in the country. Another example on how city and provincial level could play a life-saving role in providing life-saving services, which is harm reduction, can be found in Serbia. After the Global Fund withdrawal from the country in 2014, the service largely collapsed. Only one civil society in Novi Sad was able to continue, and that was because they received funding from the municipal government. So although the Global Fund re-entered a few years later and was able to push the Serbian government to increase their domestic funding, that municipal funding provided to that civil society organization was very crucial to ensure that the continuity of services. And HRI also continued to work around budget advocacy, and we see some interesting progress in some country partners. For example, in Kenya, our partner, Focal Kenya, saw an inclusion of harm reduction for the first time in the county development plans in Kisumu County. And in Indonesia, my country, our Indonesian partner, Rumah Cemara, also invited in the pilot social contracting funded by the provincial governments. So what I'm trying to say and draw here from these examples is the importance of supporting advocates to also work at the city level to increase political support and help to secure domestic funding. And this also makes sense in the context of separation of powers between local and national government. In Indonesia, health is a matter of local government. So a push for a more active local government therefore makes sense, since they are also a budget holder, not just like the national government. But I will close by sharing the challenge that we face in this work. One of it is that we have not established enough information globally on how often this is a reality for harm reduction. I mean, funding from the municipal government is a reality for harm reduction, because accessing funding data in the city or provincial level is still difficult due to lack of effective reporting system. So this could be something that we could push more, like the availability of information and making sure that the information is distributed city level, to which they get the give the money to for services, so on and so forth, is something that we need to continue advocating for. And another challenge, and it goes without saying, I guess, is the funding gap to support budget advocacy work. Where HRI is lucky that we got support from IJAP to work with organizations in Kenya, Indonesia, and South Africa precisely on this, but it would be a lot better if there are more funding available to support the community work to get more funding from the domestic government, from the local government. I guess that's it.
Thank you so much. And of course, you touched upon the core issue of funding. And for that, I think, all the data that you collect, that you gather, is absolutely essential to actually advocate for more funding. I'm conscious of the time. We're getting close to the end. I know there are people from the floor who want to make comments or ask questions. Before we conclude with Madame Dreyfus. But before that, I want to give the opportunity for people from the floor to speak and make comments.
No, I can't speak with you. Okay. She has to speak.
All right. So, okay, we'll go it that way. Do you want to make some, points, and then we'll take the comments at the end? Madame Dreyfus, I'm not sure I need to introduce yourself either. You're the former president of Switzerland, the first woman elected president in Switzerland back in 1909. We all know you. We all know how engaged you are on health, social issues, including drug policies. in Switzerland. We owe you a lot today as girls, women, mothers in Switzerland. And please, you have the floor. Madame Lopez.
Thank you so much. I will not take too much time because I think there is also some questions in the coming from people who are
we have time
online. So let me just say a few words in the name of the Global Commission on Drug Policy. I mean, the drug issue is a very complex issue and it has several layers. We know that there is an international community that 60 years ago decided a certain kind of policy against trafficking and consumption of drugs, and that this system is still working. And as we show in this little video, it was reinforced between 61 and 88. And it is still in vigor. And when you come to discussion in Vienna about how to reform, you see that there is no consensus on change. And for the first time in the history, I think, of this convention, in last March, there was a vote. Because generally there are no votes. We have all to be to agree. And what did that mean in the last years? It means, in the last decades, it meant that the harsh group of countries who didn't want reform didn't move at all. And the group of those who wanted reform made all kinds of compromise and discussion and negotiation to make baby steps, but even the baby steps were quite impossible. So that is the highest level. But the level of the national legislation is strongly influenced by this international regime. And it is strongly influenced because the country decided over this 60 years that they are parties of this convention. And there are not many countries who would make the steps to say, okay, we made a commitment, but now this commitment is no longer our commitment, and we withdraw from that. We have some examples from countries who did it, but returned afterwards with a special clause. So we have the level of these laws who are a copy, I would say, of the international convention. And we have the local authorities, and they have the problem. They have the problem, they have the people suffering from drug abuse. They have the people who, through drug abuse, lose their job, lose their housing. And to take the example of AIDS, are considered as a threat and for the whole society, a threat of contamination. And they are dying of overdoses and so. And this is the reality of the state. It's not the reality of the state. It's not the reality in Yemen. It's the reality here. So our work of the Global Commission is clearly on all levels. And as former, as Michel said, we have a chance to speak in Vienna and to speak to government and to speak to local authorities. And this is a great chance for us. I mean, that is the reason why we are continuing for many years to advocate for changes, because we are convinced that this change can be made on the 3 levels. What I said before about March 24 in Vienna show how difficult it is. So 30 years of a battle for me, for instance, because I began really with advocating for harm reduction in Vienna 30 years ago. But now it's an evidence. It's an evidence that it is useful, that it is necessary, that it works. And this evidence is now largely accepted. I mean, it was first to fight for 30 years, but not only to fight, but to show And where did we show? On the local level, mainly. It was the experience, the initiative taken on city level that were accepted or not accepted by national government, who could make the demonstration that it is necessary, useful, and that it works. And we have to continue because the scale of the realization of these reforms is far too low. I mean, far too many people are not in the benefit of such measures. But what we have demonstrated, and when I say we, it's a community of people advocating for change, what we have demonstrated is that the city has a margin of maneuver, that they can do it, that they have to do it because it is the need of their population. It is what the family are asking. That's my experience. I was in the Parliament of Bern, and I know what the family wanted. I know what the brothers and sisters wanted for their siblings. And we had to defend afterwards when I was in the Swiss government to say, let the cities do what they have to do. Let them collect the experience. Let them exchange their experience. And on the national level, when I had my experience, first experience, it worked also. Because one city influenced the other city. Because we learn good practice from one city to the other. And for those who don't know Geneva, Geneva is a good example of being very proud, very, very brave in experimenting, but sharing also with others. So our advocacy as a Global Commission on Drug Policy is not only to help cities. We were in Glasgow, I was in South Africa, I was in Ithaca, New York, and so on. It's not only to encourage the cities, but to equalize them. We cannot do it alone. We are a little secretariat, we are a little group of people. We cannot build an organization. And perhaps there is no need for a big organization because we have UN Habitat, we have Cities Against AIDS, we have City for Health, we have for Healthy City. We have a lot of possibility of exchange between all these cities. But let's put drug policy in the heart of all this coalition, all this work. Let us organize this exchange at any opportunity that is given, and that is what we want to do. We want to do it under the flag, if I can say, of the principles that were discussed with us and in Glasgow, but it is a work in progress, and we are really eager to be one of the many people and organizations who are working in this sense. Thank you.
Thank you, Madame Dreyfus, and talking about the fact that big changes can be made at the 3 levels. I'm now keen to let some of our states speak, and I'm sorry about the time, we're running out of time. Barbara Fontana, who's counselor at the Swiss mission, you want to take the floor?
Yeah, I wanted to make sure that I don't say President Dreyfus would like me to say, since most of our policy is based on her work, which was the Federal Council and head of the Ministry of Home Affairs. But just to say, first of all, that we're happy to be associated with this event and to be partnering with both the Global Commission on Drug Policy and the Global Cities Hub. And that we really liked many of the interventions today, which would show again that due to their proximity to the affected population and their ability to respond quickly and effectively to local needs, cities and municipalities are particularly well positioned to develop and implement effective and innovative harm reduction strategies. So that is, I think, something we can all agree with. And in fact, pragmatic solutions to tackle new challenges are often required in cities and municipalities before the necessary framework conditions, including legal ones, can be created at the national level. There's some kind of also a bit of experimentation, and this was where my intervention came. I was worried it was going to be overlapping with yours, is that in the late 80s and early 90s that people tend to forget, but Swiss cities were directly affected with the then rampant heroin and HIV epidemic, and were forced to find new approaches, and that the pressure for change in national drug policy thus came first from the directly affected urban population. And just as a good example of such bottom-up solutions was the world's first consumption room was founded in Bern in 1986 by grassroots organizations. This consumption room was operated in a legal gray zone at the time. Other cities quickly followed this example, but it was only much later in 2008 that the concept of harm reduction was definitely enshrined in the National Narcotic Act. So that's one of the elements. Others, such as controlled heroin distribution or needle and syringe exchanges, just to name a few, were added in this period as well. They are all a result of a fundamental change of paradigms that has taken place at the national level and local level. Drug policy was now to be addressed first and foremost as a public health issue. So it came from the cities and it changed into national policy. In Switzerland, canton cities, municipalities are responsible for providing harm reduction services. The federal government's task is to create a legal framework at national level, develop overarching addiction strategies, create a scientific basis for the effectiveness of harm reduction programs, and ensure that the best of practices are applied throughout Switzerland. So it is also fundamental in this model that knowledge and experience are exchanged top-down and bottom-up, and national authorities are required to coordinate in both directions. And I thank you very much for your
Thank you. Thank you. I next have David Jara from Colombia, if you want to take the floor as well and make comments.
Yeah, thank you very much for having us. And
you need to speak out a little bit, sorry, so that people online can hear us.
Sure. And thank you for allowing us to make this brief intervention, and especially to the grateful. It's an honor to be here today. Please allow me to thank the Global Commission on Drug Policy and the Global Cities Hub Geneva for organizing this timely event that so clearly aligns with the vision that Colombia has been sharing with the international community in the past couple of years. Drug policy should prioritize public health and human rights. Making it a reality is an effort that goes beyond national governments. It requires a whole of society and whole of government approach. We do recognize that today's event is focused on urban settings, but I would like to highlight the importance of also keeping in mind the interrelation between the urban and the rural, and at the local level vary from region to region, from country to country. As it was recognized in the new urban agenda, there are structural territory disparities that are fundamental to be addressed when implementing a local approach to drug policies. Identifying the structural causes also came with the determination of addressing them through a subnational approach based on citizen participation, the strengthening of institutions, and transformation of the socio-economic conditions of local communities. We are essentially materializing one of the messages that have resonated today. Drug policies need dialogue and cooperation at all levels of government. I would like to touch on harm reduction measures as well. The Global Commission recently organized an event devoted to this topic, where our Ambassador Gajon, share our perspectives and endeavors. On this occasion, I would like to stress the importance of collaboration between local governments and civil society organizations in implementing targeted measures on harm reductions. Grassroots organizations have access and are in touch directly with reality on the ground and can be powerful and effective partners when finding tangible and tailor-made solutions to daily people's challenges. Allow me to finish by sharing the perspective of a country that has deeply suffered from the punitive approach of the international drug regime. If we do not build together, if we do not listen to the communities, and if we do not fulfill our commitments to human rights, we will continue to fail in achieving the goals to welfare and health of humanity. Thank you.
Thank you very much, David, and your message carries a lot of importance, given that, as you said, your country has been, affected by very repressive policies. And last but not least, I have the City of Amsterdam, Peter Wanga. You are an advisor to the players. I'm sorry to make you speak last, We have 3 more minutes before we close the event. Peter, you have the floor. If you can switch on your video as well, it's nice to see everything.
I'm not sure I'm able to switch on my video at this moment because I was only granted permission to speak. So I'll just keep it like this.
Okay.
First of all, we are very grateful that the Global Commission, all the people who are in this meeting, recognize the importance of the local level. And we need not to say much more about cities being the breeding grounds of change in drug policy and in many other policies as well. So I'll skip that part. But I would like to point out that in Amsterdam, a lot has been happening when it comes to new drug policies. In January, our mayor has organized a conference, and a lot of you have been there as well. Mr. Dreyfus, Mr. Bam, Mr. Sidibe, Judy Chiang, and many more probably in the audience. And our mayor had the idea from the perspective of safety and also from human rights and also from health perspective that something needed to be done, and that maybe another way of approaching drug policy could provide a solution to the war on drugs that has been going on. And this conference was very important to us. And well, like I said, many of you were there, so we do not need to go into the details of the discussion. But there is one question that remained from the conference, and that is how cities can play an important role in this difficult international debate. So we're very happy that this webinar is happening, and we're also aiming for another conference in Warsaw in December, and I would like to invite you all to be at this conference. It's a harm reduction conference, and we will organize a we will organize a satellite conference adjacent to this conference and go deeper into these important questions of cities playing a role in the important discussion on progressive, more controlled regulation, progressive drug policies, etc. So the discussion is not over yet, and we are hoping to get you all on board to be in this conference as well and help us to prepare for it. And one last thing, after our conference in January, we issued a manifesto, and it can be found on the website dealingwithdrugs.com. So if you are willing to share this website and read the manifesto, it's open for endorsement. So I would like to ask you all if you agree on what's in this manifesto when it comes to important issues on drug policy. Feel free to endorse and to bring it forward. That's about it from Amsterdam. Thanks for giving us the opportunity.
Thank you very much, Peter, and I'll be more than happy to circulate the manifesto to all those who have registered for this meeting. We're coming to the end of the event. I'm sorry about the time. I know there are questions that have been raised on the Zoom. What I'll do is that I'll take them and we'll send them to the speakers to see if you have elements of response. Sorry, a bit more homework for you to do, and to see whether you can respond to those questions. Thank you so much. I think a lot has been said. We've touched upon underlying socioeconomic factors leading to drug use. We've touched upon funding, for in terms of drug policy, talking about law enforcement, about urban safety, involvement, affected communities, the role of states, basically, and the interrelationship between states. City level is very important, as well as with civil society. As has been said by Colombia, drug policy needs dialogue at all levels, and we're there to basically foster that kind of dialogues. So thanks a lot. We hope to continue. Indeed, it's not over. There are chances that we will still be there to, unfortunately, discuss about, how to advance drug policy, but bit by bit, building on what we've done in the past. And I'm looking at those sitting at the Human Rights Council to see to what extent, we could also involve cities in the next resolution that is being dealt with at the Human Rights Council. So thank you so much for those online, for those in person, and have a nice afternoon.